Hello everyone. So today we will be discussing about anesthesia modifiers, CPT. Okay. So here I have taken all the modifiers which is related to anesthesia. And normally you might be knowing other modifiers also. Now modifier 22, 23, 24, those modifiers. Apart from that, this is anesthesia modifiers which we will be using along with anesthesia procedure. So here I have given a list of modifiers, that is modifier AA, modifier AD, GC, QK, QX, QY, QZ, QS, P1, P2, P3, P4, P5, P6. These are the list which we are going to discuss today. For each modifier I have given a description as well as a coding example also for your clear understanding. Don't skip the video in between. First we will see modifier AA. Modifier AA is used in medical coding to indicate that anesthesia service was personally performed by an anesthesiologist. So normally whenever you are coding for anesthesia procedure, most of the procedure will be done by anesthesiologist only. So don't forget to give AA modifier along with the anesthesia code. Next comes modifier AD. Modifier AD indicates that anesthesiologist was supervising more than 4 concurrent anesthesia procedure. That is anesthesia service done for multiple patients simultaneously. So in this case, he will be supervising the procedure. Okay. For this I have given an example also. So along with the anesthesia code, you have to give the AD modifier. Next comes modifier GC. Modifier GC indicates that the service was performed by a resident under the supervision of a teaching physician. It is primarily applied in teaching hospital where resident, that is physicians in training, are actively involved in patient care under the guidance of an experienced physician. Here I have given an example. Go through it. Next, modifier QK. Modifier QK is used to indicate that anesthesiologist provided medical direction to 2 or 4 concurrent anesthesia procedure involving CRNA or anesthesia assistance. So here he is giving medical direction to the CRNA for doing this 2 or more concurrent anesthesia procedure. Next comes modifier QX. Modifier QX is used to indicate that anesthesia service were provided by a CRNA with medical direction by an anesthesiologist. Okay, here for one procedure the CRNA is being directed by the anesthesiologist. For this I have given an example. Please go through it. Next comes modifier QY. Modifier QY indicates that anesthesiologist is providing medical direction for a single anesthesia case involving a CRNA. This modifier specifies that anesthesiologist is overseeing just one case where a CRNA is administering anesthesia under the anesthesiologist guidance. So example for this procedure also given here. Next is modifier QZ. Modifier QZ indicate that anesthesia service was provided by CRNA without medical direction by a anesthesiologist. So here the example for this is given here. Please make a note of it. Write and keep. Okay. So at the time of interviews or while preparing for your CPC exam and all, it will be more helpful for you. Next comes modifier QX. Modifier QS indicates that patient received monitored anesthesia care. That is monitored anesthesia care involves administration of anesthesia service during a procedure where the patient's conscious level is monitored and sedation is adjusted necessary to ensure comfort and safety without reaching deep sedation or general anesthesia. Okay, next is modifier P1. Modifier P1 indicates that anesthesia is given for a healthy patient. That is, the patient is not having any other disease conditions or anything. For a particular surgical procedure alone, they are giving the anesthesia. Apart from that, he doesn't have any health condition. In that case, you have to use P1 modifier. Next is modifier P2. Modifier P2 indicates anesthesia is given for a patient having mild systemic disease. Mild systemic disease examples are controlled hypertension, mild asthma, controlled diabetes, mild obesity, hypothyroidism. These are the conditions. The example is also given here. Next, we will be discussing about modifier P3. So in modifier P3, it indicates anesthesia is given for a severe systemic disease, for a patient with severe systemic disease. So severe systemic disease examples are severe hypertension, moderate to severe asthma, controlled diabetes, chronic heart disease, chronic obstructive pulmonary disease, COPD. So these are the severe systemic disease, and example for that is given here. Next comes modifier P4. Modifier P4 indicates that the patient has a severe systemic disease that is constant threat to life, that is high level of risk due to the patient's health condition. We can say congestive heart failure, severe COPD, advanced heart disease, end-stage renal disease, severe uncontrolled diabetes. These all comes under severe systemic disease that is constant threat to life. I have given an example also. Modifier P5 indicates that patient is a moribund state and is not expected to survive without surgery. Moribund patient means by doing surgery only, after surgery only we can give hope also, like the patient will survive or not. That is multiple organ failure, trauma, myocardial infarction, sepsis or septic shock, critical respiratory failure. Example is given here. Next comes modifier P6. Modifier P6 is used to indicate that the patient is declared brain dead and the anesthesia is being provided for organ procurement purposes. This classification is a part of American Society of Anesthesiologists. So here the example for P6 is also given. So these all are about anesthesia modifiers. Thank you so much for watching. Next we will get into this qualifying circumstances. Okay, next video will be that only, I think. So thank you so much for watching. If you haven't subscribed, please do subscribe. Thank you. Take care. Bye bye. If you have any queries, you can put it as a comment also. Don't forget to like the video. Thank you.